Good morning, everybody. And I'm really glad to talk to students. That is one of my most favorite, it's a favorite thing in my life. When I returned back from Australia in 2009, after my fellowship in Pediatric, Hematology and Oncology, I was given an option to work at least in 4 hospitals, including Adyar Cancer Institute, which I have a highest respect. But I took over a medical college. Simultaneously, when I want to treat the children with cancer, I always wanted a connection with medical students. So that is the only reason I took over a medical college. And today I have a privilege to talk to students who have been treated for cancer before and then now are students and who are going to be leaders in the country in the future. So I thank the opportunity given by Samiksha Foundation for this. So born again in Christian religion term is spiritually born in terms of after a baptism. So born again means now even after COVID, everybody are considered as a warrior and we congratulate each other for beating COVID. But I personally feel, having gone through COVID for myself and having gone through this cancer war for 20 years with the children and families, that COVID is not comparable with cancer or cancer is not comparable with COVID. Next slide, please. And not the COVID warrior, but all the people who fought cancer has to be called as cancer warriors. And believe that a government should have an award like Veer Chakra award, which has been given to or awarded to soldiers who fight for this country. The same equivalent award is needed to be presented to each child who has fought against cancer. Even if they have lost, their family has to be awarded. This is my imagination. The highest award or highest war personally you can feel or fight inside your body is against cancer. Next slide, please. Everything in the life, maximum achieved satisfactory thing were achieved through shedding some blood, sweat, and tears. The typical example is the delivery of a newborn baby. You cannot deliver a baby without shedding a blood or sweat or tears. In my philosophy, anything which is achieved by justice, definitely these 3 things have to be shed. It is almost equivalent to a fight against cancer. If you look at Gandhiji's book, The Test to Truth, every page has some difficulties which he has faced. Or Mother Teresa's Missionaries of Charity. I'm sure Samiksha Foundation, Sandhya would have felt the same. So you don't need to worry when you have to shed blood, sweat, or tears, because the good things will be achieved by that 3 only. Next slide, please. And if you look at this picture of a war where the soldiers are fighting, after the war or during the war, a thorn prick will not be any issue to a soldier who has been fighting with bombs and blast for their country's sake. I don't support a war at all. I don't want any more Kuruksethram. I want only love and peace. I don't want countries to fight. I don't want religions to fight. It is only a comparison, not to support war. But having gone through childhood cancer war, the miseries in life will be a thorn prick for you. That is the most important message that I want to deliver. The number of blood investigations, what you have gone through, number of bone marrows or lumbar puncture or intramuscular injections, all that is nothing when compared with the fight with the relationship or fight with the professional chief or anything, or a thesis or guide or exam failure. Nothing is equivalent to a war against cancer. So you have won the war and you are going to have thorn pricks only. You don't need to worry about life at all. And this has been published definitely in many of the studies in UK and US, where the developed countries compare the children with cancer's ability to cope with stress in compare with the peer age group. Exactly what I told has been documented in literature, that the stress management in cancer children or the maturity for that age is much better than the normal peer age group. Next slide, please. So a special mention about this war against cancer for the mothers. You can look at the womb of the mother, how the baby is protected. I have a greatest respect for nature, which is creating single arteries, arterial wall, which wall of the muscle or wall, which muscle has to be stronger, which muscle has to be thinner. If you look at a cardiac muscle from the stomach muscle or the skin elasticity, the joints and ligaments, you don't need to believe in any religion, but you have to believe that nature is the most intelligent thing in the world. You cannot create anything to nature, equivalent to nature. Breast milk is the best milk. Whatever you import, the most costliest infant food, will not be equivalent to a breast milk. So the womb, the mother's womb is the most safest area. But if you look at the mother's character, it's almost related to a hen. The hen and eagle, if you compare both, eagle is a very scary thing, hen is a very soft one. But if you look at the nature, for the chicken, if there is a problem, the hen will fight against the eagle. This is somehow unconditioned reflex that they will have the braveness. For the cancer child also, every mother is equivalent to that. I don't want to hurt any fathers here, including me, that I will make a statement now that in the last 25 years of my cancer journey, I have never seen a mother leaving a cancer child because of stress or because of financial issues or because of psychological problems. But I have seen at least 10% of the fathers becoming alcoholic or fight and leaving the family. Not even a single mother I have seen not to have a last opportunity to fight against cancer. They are very, very normal, below normal, average, uneducated, poor, homemakers, or whatever we say. But finally, if it comes to cancer, whether in government center or corporate center, they fight and fight. So my sincere appreciation to all the children and all the mothers who have fought. And of course, the fathers also, if they have really supported. Next slide, please. So if you look at this picture, and if you don't know who is this, then it's very sad. If anyone knows her, it is very good. This is Dr. Muthulakshmi Reddy, who is the first lady doctor from Madras Medical College from Tamil Nadu, and who had a sister who suffered due to colon cancer. And being the first women doctor, she had a vision to build Adyar Cancer Institute, equivalent to something, the care which she was not getting for her sister, she wanted to give for the community. So this is how the difference between women and men. Men always look at their profession, women always look at the other profession. This is the first women doctor has produced Adyar Cancer Institute. Imagine how many male doctors, including me, would have been passing through the years and years in India before independence or after independence. Why nobody started? There are good doctors like Apache also. What I'm saying is the first lady doctor created an Adyar Cancer Institute means first male doctor or all the male doctors before Muthulakshmi Reddy probably will have been like me, who would have thought of their own profession. So there is something which you can do in the society, that if you have seen a suffering or if you have suffered, you relieve others' suffering by doing something good for them. That is one message we can take from Dr. Muthulakshmi Reddy. I cannot imagine how much difficulty she would have had to be a first women doctor. And she was the member of assembly in Tamil Nadu who abolished Devadasi system, and she founded a safe home, Avvai home for women. So these are and she is married, she is a wife, she had son who took over the institution after that. So she was a woman, first doctor, mother, wife, daughter-in-law, and a doctor, social activist, and politician. And she has suffered due to her sister's cancer and looked after her. So imagine if somebody can do this without any, without much of the media support 120, 200 years before, how much we can do with one click of message, how much we can convey to the society. That is how students should think. Next slide, please. So last, I want to give you a few messages for the students to get up, which actually I am practicing. So I'm not preaching something. First thing is get up early in the morning, 6 to 7 hours of sleep. I'm sure no students will practice this or majority of the students won't practice this. There are a lot of scientific things behind this. Somehow try to practice. Once in a while, definitely one party, one marriage, festival, one New Year is okay. But routinely getting up very late, running around at 8 o'clock, missing the bus, it's very, very bad habit. Second thing is drink water adequately. One thing I practice is I get up at 5:30 in the morning without any alarm. Even if I go to US, I get up at 5:30 from US time without any jet lag or without any confusion. My brain is addicted to that. The second thing I do is I just drink water, 1 cup, normal water at early morning at 5:30. I don't know whether it is scientific or not scientific. One good doctor has told me many years before, and I'm practicing this. And I'm very thin stature by genetic. You can look at me, and I don't do exercise. That's a very bad habit. I've been professionally in a gym, but I just walk, and I just use no lift in my life. Maybe up to 7th floor in my hospital. Child Trust Hospital is 6th floor, the cancer ward. 4 floors, 3 floors, I don't use. That is something which anybody can practice. Obesity is something maybe genetic, maybe junk food, maybe exercise. But that somehow you should reduce obesity. Don't smoke or alcohol. Every movie starts with that statement, smoking kills, smoking causes cancer. That is almost like it's registered in our brain, but I don't know if it's registered in our heart. So being a cancer survivor, I don't want to differentiate from a normal population, but we have more risk. So please do not consider that. That is usually considered during our college period. I don't think anybody will start smoking from 30 or 40 years of age. All is done between 18 to 25. Be very careful. And then something that all the girls take is HPV vaccination, which is much more important than COVID vaccination. It's a vaccine for preventing cancer. And there are some studies saying that vitamin D supplementation is might useful for preventing some cancer. It might worth considering taking once a year. Next slide, please. And the last slide, which I have some points, that is with the greatest emotion with the 2 girl children's father, I am saying that respect your parents and elders. If you can sit and talk with your grandparents for half an hour without looking at your phone, or if you can hold your grandparents' hand and take them to a hospital, you are one of the best human beings, which might be lacking in many of you. And then very important thing is never argue anything in the WhatsApp group hurting other religious people. Whether you believe in a religion or not, you should be accepting a religion or not, that is not a problem. But the respect to other religions is very, very important. Much more than the religious faith, you should have a self-confidence. And I'm sure all of you would have got, and also a self-discipline. And wherever you go, you respect women and make sure there should be some safety. If something happens in the bus or train, you are empowered to raise your voice if something happens against women, and protect nature. Something like a plant, some trees, something to do with greenery and nature, you always get attached with them. And above all, finally, do something to others. Not like Muthulakshmi Reddy, even a closing a tap, switching off a small light which is going waste, or talking less itself is a good contribution to the country. And even standing from a seat when the mother is holding a baby and standing nearby, these are all very, very small things. The lift is open, just entering as a 8th person, wait and allow one more person who might go a little earlier than you. You might not do anything useful for the country, but these are all small contribution anybody can do. You don't need to build Adair Cancer Institute, but a small word to a cancer child or a cancer child's mother saying that I have gone through this, I have fought it, and you will fight it, you will win. That is enough for any family who is suffering from cancer. Next slide, please. And read books. That's very important. We are all connected. Jail, we are now sitting in a room, WhatsApp, social media, everything. We are now using that for a good thing, but many are misusing that. Don't get addicted. Do read books. Reading books is nothing equivalent. I'm not talking about Kindle book. I'm very old-fashioned. Take a book, whatever Mother Teresa has written or Abdul Kalam, My Journey. Read the book 2 to 3 hours. Discuss with somebody. That is something very, very important. That is where I am very, very appreciating Samiksha Foundation to building a school in the hospital. In Tamil, they say, Elutharivittavan Iraivan Avan. That means somebody who is educating is equivalent to God. Tirunelveli, one of the most famous poets who has written Tirukkural, says, an educated and uneducated difference is a difference, small difference only, a difference between a human and an animal. The animal does not speak or cannot be illiterate. That is the difference. So we are losing that opportunity of learning something for 1 to 2 years. Somebody coming and helping in that aspect is equivalent to God. Somebody who is treating the cancer is equivalent to God. The parents are equivalent to God. So Mada, Pida, Guru, Deva means Guru is in the third place because mother is the first person we are introduced. Mother introduces the father. Father introduces the teacher. Our parents introduce the teacher. And all the three will lead to the God. And in fact, Samiksha Foundation does the third point here for all of you. So we have a greatest respect, or I have a greatest respect on Sandhya for founding this and everybody who is supporting this. I, as a doctor or a team member, as participating in NGO knows, it's not only the leader who has to be appreciated. Any volunteer, any typist, any secretary, any translator. You mentioned the students, Kirtana or Bhumika, or I cannot tell anybody's name, but you take all, even the drivers or the cooks, all of them need to be appreciated in any NGO if that's good for the society. This is Samiksha Foundation is something from my heart. I'm saying it's a wonderful thing. And I feel ashamed that I have been through this 20 years for cancer children as a doctor, but I never thought of this as school. But in Australia, what you mentioned is absolutely correct. They have a fantastic system of school support officer in each hospital. Next slide, please. So that is my message for everybody. My sincere appreciation to Samiksha Foundation. And I want all the students here not to be a politician, but to support this country by being a good human being and try to change something in our life, at least to change ourselves, like Gandhi said. Thank you.